and wouldn't be able to find the results for the research. If it would also be unethical, as the participant might feel embarrassed about their weight, resulting in them starting to feel upset. If the research doesn't follow the Data Protection Act, then the participant could be in serious danger, as the researcher might use the information for scientific purposes, which might not use data for scientific purposes, which could result in the information getting out to the general public and not being kept confidential. As for the researcher, if they didn't follow the Data Protection Act, they would go to court and possibly go to jail due to it being illegal not to have one. The researcher also didn't have any respect for the client when doing the experiment. This could make the participant feel insignificant, making the participant less motivated to carry out the experiment, meaning that might be more difficult to work with and start to feel depressed and upset about the situation. The consequences to the researcher are that it is very unethical and is going against the Nuremberg Code, as it states that when the researcher is working with volunteers, they should respect the participants. The researcher are also didn't have a informed consent. This can lead to the researcher being taken to court with a fine or prison sentence. If it it is if it is as it is illegal to not inform the participant what the experiment is testing for and whether they are willing to give consent for it. If the researcher didn't give an informed consent form, then the participant might not agree to take part in the experiment due to personal issues, but be made to take part, meaning the participant feels embarrassed or worried for people about people who may make fun of them. The next poor practice the research didn't include was the confidentiality. The consequences to the participant is that data or information might be released to the general public, and that might be data the participant doesn't want anyone else to know about. This can lead to the participant feeling ugly or ashamed of their appearance, which could demotivate them to continue doing the experiment. In gymnastics, the consequence is that the researcher is that it's very unethical, as they are releasing information about the client which the participant may not want to be released to the general public. It's also breaking the BASIS code of conduct and could result in a small sue. The next poor practice is the researcher had no first aid procedures. That the consequences of not having first aid procedures towards the participant is that the participant may be in pain and the researcher doesn't have the equipment needed to treat the injuries that the participant has which results in the injuries getting much worse and more painful. The consequences towards the researcher are that he would have to attend a health and safety course, and depending on how severe the injury was, would have to pay a fine to help the participant heal. The next practice the participant didn't have was he didn't have an ethical clearance. This could result in the researcher going to court and maybe spending time in jail as he didn't get his experiment cleared at the institutional ethics, which could have meant that the experiment wasn't fair or ethical towards the participants. Scenario 2. Good practices. The good practices to Scenario 2 was that the experiment had a good test sequence, and the order of the experiment was very good. This made it very professional and appropriately done. It meant it prevented any chaos from occurring, like the participant messing about, which increases the likelihood of injury, and as it has structure and full instructions. Bad practice. The first poor practice is the researcher did in the experiment was that he didn't give the participant the right to withdraw from the experiment. This is illegal and could result in termination of qualifications and job. This is also very unethical as the researcher is forcing the participant to take part in the experiment even though they don't want to do it. The researcher has to respect the participant choices and decisions. The researcher has to also make the participant feel comfortable and feels a feeling of safety when the test is being done. This will encourage the participant to finish the experiment. The next one the researcher didn't do was that he didn't ask for the client's consent to conduct the experiment, which could lead to fine or termination of job, as the participant could say that they were forced into doing the experiment. The researcher could prevent this by getting the participants to fill out an informed consent and Part Q form to show that the researcher has told him and made sure the participant then understands what they are getting themselves into, and they give 100% consent for the researcher to conduct this experiment on them. The next poor practice the researcher did was he had a lot of health and safety issues which could have led to serious injuries resulting in a fine and loss of job or qualification. For example, the researcher didn't know where the first aid kit was, so told the participant to run their twisted knee under a tap. To prevent this kind of stuff happening, the researcher should go on a health and safety course to learn how and what to do when a participant gets a serious injury or illness. The researcher should also carry a first aid kit on them at all times and be with someone who is trained in first aid so that they can help the participant when they get injured. This will mean that you will know how to deal with injuries that may occur. It's also illegal for the researcher conducting an experiment like this if you don't have a first aid qualification and will result in a fine and possibly termination of job. The researcher should also make sure that all the equipment that they will be using is clean, clear, and isn't breaking, meaning that there will not be any germs on the equipment or any faulty equipment that will break when in use. The researcher also didn't make sure they had done or checked their responsibilities, like the researcher is responsible for the participant, so should give the participant enough time to warm up and get more active before the exercise to reduce the risk of muscle injuries like tears. The researcher can do this by doing a warm up for at least 15 minutes at the beginning and then ask the client whether they need any more time to warm up. This will ensure the client got the maximum warm up they need to carry out the experiment. The researcher also didn't have any respect for the client, as when they said they didn't want to do the experiment, the researcher just made fun of them and compared them to a girl's blouse, which is extremely unethical and inhuman behavior from a researcher that is conducting an experiment like this. To correct this, the researcher should treat the participants as if they were patients at your hospital and you had to look after them, so would do anything to make the participant feel safe and secure. Before the experiment is done, the researchers should leave enough time for the experiment to get ready, for the participant to get ready and understand what they are taking part in, enough to think about as whether they will be going through with the experiment. For example, the researcher in scenario 2 was very rushed to get the experiment started, so the participant didn't really know what was going to happen because the researcher didn't prepare the client to prevent this from happening. The researcher should tell the participant to show up at least 30 minutes before the experiment is underway. This will give enough time for the participant to set up and get ready. The researcher also didn't show any equality towards the participants that were involved, as when the experiment was getting tight for timing, the researcher decided to do the better participants first, as he wanted to see the good participants' results and didn't care as much about the bad participants. This is unethical, as he is suggesting that some of the participants should be treated better as they are more able to at the skills that the experiment requires from them. To prevent this from happening, the researcher can't show any bias towards certain people and should treat them as equals throughout the experiment. The researcher also didn't protect the participants' data, which was collected, showing that the researcher have had no ethical respect for the participant as they let the information out. To prevent this, the researcher would only release the client's data to the other researchers and their participants themselves. Finally, when the participant wanted to stop the test, the researcher made fun of him and didn't terminate the test. This is illegal as it's forcing the participant to continue with the test and choose not to stop the experiment. To prevent this, the researcher must obey the participant's requests at all times throughout the experiment. Consequences. The consequences in scenario 2 were that the researcher had a lot of health and safety issues which could have caused severe injuries to the participants taking part in the experiment, and if not near a first aid kit or first aider, then the injury could get much worse and would result in the participant having to go to hospital. Depending on how severe the injury to the participant was, would be how much they would get the researcher to pay, as the research should have checked and